Hello everyone. I just wanted to give a little update. I haven't been on here in a long time actually. So I wanted to tell my story, and if you just needed some guidance or want to give your advice, I'm here for it. So this is my story. I have multiple health issues, but this is one of the most recent things I would like to discuss. So basically, I have been battling BV off and on for the last 2 or 3 years, about 3 years now. And I started testing negative at my doctor's office, even though I had symptoms. And she did a pelvic floor exam and just said I looked very irritated, and she didn't know why. So she gave me estrogen cream, and it did help, but I still was having a lot of symptoms. And so I decided to finally take a Geno test because I was still, very symptomatic and stuff, and I couldn't handle it. So I did a Geno test, and it came back with BV and urea plasma. And so I had an appointment with my urologist, and I told her and showed her the test results. So she said, "Okay, I'll treat you for the BV and the urea plasma, but I also want to do a PCR test because I was diagnosed with overactive bladder back in 2021, so I have urgency and frequency as well." And that came back with a bunch of different bacterias. And so she told me that she wanted to switch me to levofloxacin and instead of the doxycycline. I'm not sure if I'm pronouncing that properly, but she wanted to switch me over, but I was a little skeptical to try that because I'm sensitive to that class of drug, and it's got a black box warning on it. So I told her my concerns, and due to my other health issues, it was kind of risky for me. And she said she would just send me to infectious diseases, which I got in about a month ago, and they did another PCR urine sample on me, and it came back with two more bacterias in there. And they said that they would just treat me with an IV antibiotic called Zoshin, which is what I'm currently on. I currently have a Picc line, and Zoshin looks like this. This is almost empty. I'm about to change it out, but um, so yeah, I got the Picc line 2 weeks ago, and I was a little bit nervous about it. I really didn't know much about Picc lines. Plus, I have anticipation anxiety, so the insertion was not bad. It was actually very easy. You just go in there, and they have you all layered up like you're going into surgery. And they have a machine laying on you so they can see your veins. And they inject some numbing stuff on there so you don't feel it. And that was probably the worst part because it kind of stung and burned, but they warned me in advance that it would. And it was gone within about 10 seconds, if that. And so that was the worst part. But yeah, it wasn't really no big deal. But whenever they did the saline flushing, I could feel it. It made my heart palpitate, which I'm already prone to those anyway, but it was a little alarming, but I didn't think too much about it. And then I had to go to infectious diseases to try out the antibiotic to make sure I wasn't having a reaction to it or anything. And then they flushed out my line as well, and then I had another palpitation. So I told the nurse about it, but they didn't ask if that was normal, and he didn't really know what to tell me. And so then I went to eat lunch with my mom, and I noticed I was starting to have a lot more palpitations while I was eating, so that was kind of alarming me. I was a little concerned about it, and so I called up the hospital, the department that inserted the Picc line, and they said they honestly wasn't sure what to tell me because that was not normal, and they used the vein machine to make sure they put inserting it correctly, and they said the EKG was fine, which I've been to many cardiologists over the years, and I know EKGs only like test right then and there. It doesn't mean anything. And they was about to close, and they said just go to the ER. Which at that point I was already very exhausted. I was away from home. I did a lot of driving that day, and I really just didn't want to go to the ER. They take a while, so I just said okay, and I waited until the next day, and then I decided to go. And they X-rayed me and everything, and said that it looked okay, but it looked like it was a little too close to my heart, so they readjusted it, moved it. And for a few days, I felt okay. I've actually felt better, but um, after that, the palpitations have been coming and going. One day this week, they was really, really bad. I kept getting them, and so I did have some days as well where my shoulders were kind of hurting, like the upper part of my shoulders. I don't know what that was about. I do have EDS, but a lot of digestive issues, so I did bring that up to my doctor just in case, but she didn't know. She makes sure it wasn't like a blood clot or anything, which thankfully it wasn't. But yeah, I'm very ready to get this out because I have to wear a fanny pack as well, and it kind of hurts my back, like carrying that around all the time. And I mean, it's not really no big deal, but it's kind of a nuisance. And I get this cord snagged on everything, so it's pretty long. And even when I wind it up where it's not quite as long, it still gets snagged at every little thing possible that it can. Unfortunately, my bladder symptoms are not, they're really flaring up, but I've also tried to treat the BV. And I feel like I have to keep going to the bathroom. Like I feel very irritated and dry and itchy, so I don't know if I'm reacting to medicine or if I developed another infection or what's going on. So I told my doctor, I brought it up to her, and she's going to run some tests. She did run some tests on me. I'm going to see, make sure the test is clear. Tonight is my last dose of the medicine, which I'm about to change it out, which I'm very thankful for. Basically, to change it out, all you do, depending on your doctor, I mean, of course, go to your doctor and get instructions on what to do. But for me personally, what I have to do is you have to make sure you really scrub your hands. They'll give you a saline flush, and then you also you flush it out with saline. Then you put heparin in if you need it. Not all doctors give you heparin, so you may not need it. But if you do, you put some heparin in there, and then you cap off the line with some lids they give you, and then you go take your shower, whatever it is you need to do. Mine, they let us put it on idle for an hour without the antibiotics to go take your shower and stuff. And then after you're done showering and ready to hook up a new medicine, you just unscrew the cap, and then you flush it with saline again. You gotta make sure you sanitize it as well. They give you alcohol pads. Make sure your hands are really clean because you don't want to get an infection. And then you flush it out with saline, and then you start your antibiotics. So it's really not no big deal. Mine has a clamp on it as well, so I have to make sure the clamps are unclamped, on the antibiotic and the Picc line. And I'm actually handling the antibiotic fine. It's the Picc line I'm not handling that great. And then like I can't sleep but on my back either, so that's very annoying because I'm a stomach sleeper. And so I'm just ready to get it out. I'll get it out Monday, so I'm really looking forward to that. I finished my last dose of antibiotic tomorrow night. It's been a very long 2 weeks, and then Monday I get to get this removed, which I'm actually a little bit nervous about because I don't know really what to expect with getting it removed. But I mean, I've read articles and they say it's fine. They say it's not a big deal and it's out within just a few seconds. So hopefully that's the case. I mean, I'm not particularly normal because I keep having problems anyway, so it's hard for me to know, but I guess I'll find out and see. Hopefully it goes well. Every time I go to the doctor, I do feel the saline, or even when I had a blood draw last week, I could feel like gurgling in my chest, and it just felt really weird. It felt like a gurgling and a suction sensation, and I told the nurse that I felt that, and it was weird, very weird and creepy. And then this last Friday when I got it done, I didn't feel the blood draw, but I definitely felt the saline. It felt like kind of like you're watering a plant or something, and then it kind of just gurgles around, So I don't know if I'm explaining that very good, but so I don't know. That's that. Hopefully the palpitations will get a lot better once I get the line removed. I'm definitely ready. So hopefully that goes well. Yeah, just thought I would give a little update, and that's my update on my Picc line. So hope you're all doing well. You take care.